RA. So another autoimmune disorder, just like myasthenia gravis. This one's more common. Contrary to popular belief that this is an old person's disease, no, not really. Osteoarthritis is an old person's disease, but rheumatoid arthritis can affect all age groups. In fact, we have young people who develop RA, say teenagers or even between 20 and 40 years of age. Okay, mostly women are affected. The incidence increases after the 6 decades, so you're in your 60s. This will be the peak of the disease. Again, it's autoimmune. And again, females 3 times greater than having it than males. So most of our patients are females. Because it's an autoimmune disorder, do we know exactly what causes autoimmune disorders? Any of them? Crohn's, psoriasis? No, we have no idea. Because if we did, then we would have a cure for them, correct? Okay, because we don't know, we have no cure for autoimmune disorders. So here we have autoantibodies that obviously attack the joints. So they break down collagen in the joints, affecting all joints, but specifically the fine motor joints in our fingers, our knuckles, our wrists. Unlike osteoarthritis, which affects the weight-bearing bones, the knees, the hips, the shoulders, these affect the fine motor joints. So these are crippling. Okay, so this can cause disability because how can you still function without your hands and your fingers? Okay, so we need full mobility, right, of our hands and fingers in order to function in society, for us to take care of ourselves. So the result here is because the joints are destroyed, the synovium is destroyed, then the patient will have pain and decreased mobility as a result. Manifestations, number one is joint pain and inflammation. The pattern for RA is symmetrical. It's always going to involve both sides of the body, meaning unlike osteoarthritis, where in one knee, like say, for example, I have osteoarthritis, my left knee is pretty bad, but my right is okay. Okay. So in rheumatoid arthritis, if it affects my left knee, my right knee is equally affected, right? It's always symmetrical. Both hands, both index fingers, both everything. Okay. It's always symmetrical in pattern. Other criteria, of course, is unlike osteoarthritis, wherein the patient has basically wear and tear, there's really no systemic inflammation indication. So here in RA, there is systemic inflammation, not infection, but there is inflammation. And what are the inflammatory markers again? ESR and CRP. So these are elevated in patients with rheumatoid arthritis. Initial again, symptoms, it's always pain and joint inflammation. So the joints are stiff, especially early in the morning. The joints loosen up after, a few movements throughout the day. But then the cycle goes on tomorrow. So meaning after a long period of inactivity, the joints become stiff as a result. And then they develop these symptoms, like again, symmetrical joint pain, swelling, warmth, erythema, meaning redness, and lack of function. They can't move the certain joints. The joints feel spongy or boggy tissue owing to the destruction of the collagen in the joints. To make a diagnosis, the doctor may aspirate fluid from the joints and then examine it for any to rule out other causes like infection, for instance. So physical symptoms are joints are hot, swollen, and painful. Not very easy to move. Again, symmetrical in pattern. Over time, the patient will have more systemic symptoms like fever, weight loss, fatigue, anemia, and they somehow are more prone to Raynaud's phenomenon. Do you remember Raynaud's from Research 1? Yeah, this is the painful spasms of the hands and wrists during cold weather or stress. So it's either induced by stress or cold weather. That's Raynaud's phenomenon. So this is on top of the rheumatoid arthritis. So this is basically a separate disease condition. Another, Raynaud's phenomenon, we don't really know what causes that. But it's common in people with autoimmune disorders, meaning besides rheumatoid arthritis, so people with lupus, psoriasis may also have Raynaud's phenomenon, because they usually occur with people with autoimmune disorders. So we already discussed the findings and the laboratory testing that will be done. Let's go to management. Is there a cure for rheumatoid arthritis? Or for any autoimmune disorder? No cure. So all we can do is treat the symptoms, put the patient in remission as symptom-free for as long as possible. That's all we can do. And keep in mind, this is an autoimmune disorder. So what will always be part of any autoimmune disorder? Not exactly. Yeah, so what kind of medications? Because it's your own body that's attacking your body parts. So what's always part of the therapy? Immunosuppressants. Okay. So the largest group of drugs for RA treatment is called DMARDs. That's disease modifying anti-rheumatic drugs, DMARDs. So we have so many DMARDs, but the goal of all these treatment is, of course, to decrease the symptoms, put you in remission. Remission means you are disease-free or symptom-free, sorry. And then decrease the permanent joint disability, because these patients will develop eventually, without treatment, patients will develop what's called swan neck deformities. Let me show you the picture. So this is what your finger will look like. So when your hands and fingers look like this one, for instance, tell me how you're going to wipe your butt. You do number 2, how are you going to clean your butt? How will you button your shirt? How will you open a doorknob? How do you drive a car? You see what I mean? Okay, so we are trying to prevent this deformity here. So the treatment is because what's the nature of the disease again? What is your body doing to itself? Destroying what? Destroying the joints, okay, particularly the joints. So that's why we put them into remission. We give them immunosuppressants to stop the antibodies from destroying the joints, to preserve joint function, preserve mobility. Okay. So early in the disease, the most common drugs to start the patient with, which is also the cheapest, would be methotrexate. Okay, this is the cheapest option. There are, sorry? No. Methotrexate is actually can be used for chemotherapy as well. So this is a disease-modifying drug. So this is what DMARD means, disease-modifying anti-rheumatic drugs. Okay, so this will suppress the immune system. There are other options like these, sulfasalazine. This was the one used to treat Crohn's disease, if you remember. So sulfasalazine is also used to treat other autoimmune disorders like rheumatoid arthritis. Hydroxychloroquine, do you remember this drug? It was made famous by the former president during 2020. Okay, it's an anti-malarial agent, yeah? Okay, so this can also be used to treat the symptoms of rheumatoid arthritis. Because these are immunosuppressants, so naturally, what's the consequence of taking immune suppressing medications? All right, so that's why you monitor the patient's CBC. You watch them for neutropenia and even anemia. Okay, so you watch the CBC for these patients. That's a natural side effects of treatment. Okay, so here causes bone marrow suppression. So you check the liver and also the patient's CBC levels. Now, for patients with more advanced diseases, a methotrexate won't be a option anymore. So the patient will now begin the more expensive treatments. So these are the ones you see on TV. So these are unlike steroids, which have systemic and broad side effects, which cannot be used. Steroids, you can't really use that long term for autoimmune disorders. We only use steroids for exacerbations. Okay, so when a rheumatoid arthritis patient has a flare up, we can put them on steroids, but only for a short time. Here, these are long term cell specific treatments, meaning these will only target parts of your immune system cells that are responsible for the rheumatoid arthritis symptoms, meaning these are responsible for the joint swelling and inflammation, particularly interleukins, interleukins 1, interleukin 6, and also your tumor necrosis factor, B cells, T cells, meaning we don't target the entire immune system. Okay, because do we still need protection from other diseases? Yes, we need protection from infections, right? So this kind of treatment is more cell specific. Yes, it will suppress the immune system, but not as bad as steroids do. Okay. You've seen commercial. An example of TNFA inhibitor is Humira. Have you seen Humira advertisement wherein they say, before starting Humira, tell your doctor if you have TB or are prone to getting TB. Have you heard that? Okay. So why do they say that? Why do we test you for TB? Remember, we did TB already. What are the two forms of TB? Active and inactive or latent TB. So for inactive TB, can that be reactivated?
Yes.
Yes, this is the reason. So if you take these drugs, they will potentially reactivate TB. So if you have inactive TB and you did not receive treatment and you start this drug, can you get TB now? Yes, because you already have TB in your body. Okay, so you see why I chose to be treated for my latent TB? I didn't have to. This is my reasoning because I know someday I will have immunosuppression, right? Either to my age or let's say I develop rheumatoid arthritis and I'm forced to take these drugs. So now I could develop TB. But these are expensive drugs. We have a table for all of these. Right. So here another use for steroids is you'll hear this concept, this idea a lot in med-surg. When we say bridge is what is a bridge? What does a bridge do? To connect something, right? So what are you trying to do when you use a bridge? You're trying to cross somewhere, right? You're trying to get somewhere. So that's what a bridge means, yeah? Okay. Or the purpose of a bridge. So here, a bridge is consider if steroids is a bridge, that means do you cross the bridge all the time? No, right? Only and to get somewhere, right? So that's really the idea of using steroids. So you use steroids long term or on a short term. Short term to get you to the goal. So here steroids will only be used as a bridge. One use of steroids is to get you symptom free until the other treatments kick in. Does that make sense? Okay. So you're not going to be on steroids forever. Next semester, we'll talk about consequences of steroids, okay, under Cushing syndrome. That's another semester. So there are many drug options in this class. All of them, of course, are expensive. For symptoms, so for pain symptoms, the patient's only option are NSAIDs. Unfortunately, NSAIDs can cause several side effects. So we've got adverse effects like kidney damage. If you take it forever, we have bleeding. Yeah, because it prolongs bleeding time. It can also can also cause heart disease as well. Especially if you already have heart disease, then that could increase your chances of a heart attack if you have heart disease and you're taking NSAIDs. We'll talk more about NSAIDs side effects when we discuss pain next week. I think, no, next week is your presentation. Following week.
Not next week.
Following week. Next week is your presentation. So other interventions are, we got nursing interventions for RA. So we've got if the patient doesn't have, they have contraindications, for instance, for NSAIDs, let's say they have kidney disease or they have bleeding disorders, then there are topical NSAIDs. Please look at your textbook because the Apple TV is not working. I'm on page 1080 under topical analgesic agents. Okay, so topical ointment is by what's the brand name for diclofenac? It's a tube, like a toothpaste. Starts with a V.
Both.
What?
What?
Voltaren, yeah, okay, thank you. Voltaren, that is diclofenac. That is a topical NSAID. Okay, so it works very well. I use it. Okay, so put it on as needed over the affected joints. Another non-pharmacologic intervention is losing weight, because added weight, obesity will exacerbate stress on your joints, so that would help if you lose weight. For what do we give the patient again if they have a flare-up?
Plasma, exchange in IV.
No. For this one, steroids. Okay, so short-term steroids will be used. These patients, yes, they may benefit from IVIG and plasma exchange, but that's not commonly done for rheumatoid arthritis. It's done in myasthenia gravis, but not really for rheumatoid arthritis patients. And here's your nutritional therapy, increasing fiber, increasing fruits in the diet, reducing calories. Other problems associated with RA, because you have chronic pain basically, right? So what will that do? Imagine at your age right now, if you have RA, you have all these joint pain. How will it affect you? Okay, so you can't walk, you can't move. What will be consequences there? Will you have GI problems? Yeah, constipation, right? You have pressure injuries, DVTs. Okay. What about psychosocially? Now you can't work. All right. So those are the unspoken results. Okay. Of someone, especially if they affect women. Or again, who are mostly affected here? Mostly women. So women your age can have rheumatoid arthritis. So at home, what are non-pharmacologics? So that's when are the symptoms worse again?
Morning.
Early morning or at the end of the day? Early morning. The joints are very stiff. So what are options you can do to get you moving? Let's start with the most practical. So when you get up, what do you usually do?
Exercise. Range of movement.
Exercise will be hard because the joints are very stiff. So what can soften those? Oh, shower, right? A bath or a shower? What's easier?
Shower.
What could happen if you have a bath?
Brown.
Well, probably not be able to get up because the joints are very stiff. Okay, so you'll have problems getting up. So a shower, a hot or cold shower?
Hot.
Okay, a warm, not really hot yet because you'll burn yourself. A warm, okay, a warm shower would be good. That will soften the joints, yeah, get you moving. Okay, so you feel good. And then keep moving the joints. Okay, I'm not saying, do heavy lifting, nothing like that. Just, aerobic exercises, make sure the joints are moved because once you get them softened, they're less stiff, then you can go about your day. And then the cycle goes on again tomorrow. Okay, they'll be stiff again in the morning. So the systemic symptoms will be since there's fatigue here, that's something challenging because the fatigue here is not caused by anemia. Okay, unlike anemia wherein you can increase the red blood cells and then you feel better. This one, the fatigue is not caused by anemia. So there's not much you can give here. It's not again caused by lack of energy, really. They're fatigued because of the disorder, right? So it's not like it would be made better if you take a 5-hour energy drink or a monster drink. It's not like that. Right? Because the treatment involves immunosuppressants, so what will be your caution to these patients?
Risk for infection.
Okay, so make sure they are aware. So should they be taking flu shots, COVID shots? So no flu shots. They're at risk for infection, so no flu shots. Yes or no?
Yes.
Yes, vaccinations, that's very important. So otherwise they'll get the flu and then they get pneumonia, they get septic, then they die. Okay. Now, considering let's imagine your age. Okay, you're the patient with rheumatoid arthritis. We're okay, Antonio and Fernando. We're okay. Usually the females, right? Remember, 3 times more likely to get RA. Plus, there are no RAs in my family, in the males. I mean, my mom had RA, and my grandma also, but none of the men had RA. Okay. It's not really, there's no evidence, but autoimmune disorders tend to. Okay, but you notice the textbook didn't really say hereditary, right? Didn't mention anything, but the trend is if you or a family member have an autoimmune disorder, you may likely have not necessarily the same, but some other family members may develop another type of autoimmune disorder. Remember, we don't know the cause of autoimmune disorders. So let's say at your age now, and then considering the side effects of the drugs, where's the drug? There's a table. It's not under RA, it's under lupus. The table is here. Okay, so what I'm looking for. So imagine yourself, right? Receiving treatment for RA. And you have these side effects of you're prone to infection. So are you likely to comply or are you going to be resistant? All right, here, table 34-2. Look at so we've got the NSAIDs here, and these are the side effects. I mentioned a few earlier. DMARDs, these are the side effects. Look at that. GI upset, skin rash, headaches. So this one has hydroxychloroquine can cause ophthalmic problems. Or here, if you put on sulfasalazine and GI effects, methotrexate, azathioprine, cyclophosphamide all cause bone marrow suppression. That means you have anemia, thrombocytopenia, and neutropenia. Liver side effects. Here, because these drugs cross the placental barrier. Are you all here childbearing age? Yes, you are. So what do you need to do while on these drugs? Okay, make sure how many? One or two? That means two condoms. Or what? Two different types, okay? Doesn't mean two condoms. You want to use barrier condoms, but make sure you have a backup as well. So what's this? Why do they do this? It's serious, right? It's teratogenic. So your poor baby, your poor fetus will be deformed. Okay. Then what if they survive? What will they look like when they come out? Yeah, well, they look like a methotrexate baby. Okay? What will happen to them in school? So look, considering all of these side effects here, are you likely to be very open? Oh, yes, please give me treatment, please. Or will this be a challenge for your patients? Quite challenging. But consider the alternative. The alternative is this. This is the alternative. Early onset of these permanent joint deformities. Once your joints are damaged, this is what your hands will look like. Just give you I'll share, of course, my mom had this, but my mom was bedridden for a while. Let's use my aunt. She used to live in Jersey, but she's older now. She's in her 80s. She refuses to live with any of her children. You know, she likes her independence. She's divorced. So she downsized. She had a big 4-bedroom house in Jersey. She went to North Carolina, small apartment. Yeah, 2-bedroom apartment, and it's no stairs. So just a bungalow, right? But she can't handle, going up and down the stairs anymore. She has these hands. She refuses to be driven, so she still drives herself. Okay. Lives independently, no housekeeper. She cleans her own house. She cooks herself. All right. Well, hear me out. Okay. So some people are like that. Okay. So that's how they are. She's always been like that. Okay? Always independent since she was single. And I don't know how she manages it. Her hands are literally like that. She drives a car.
If she learns to adopt, she
I
adopt.
guess.
Huh?
She adapted. I
She
guess.
adopted.
No, she has a Lexus and it's no modifications. She drives. Although no, very good steering. Yeah, very good steering. Yeah, it's a nice car. But otherwise, no, she has no adaptive, but I don't know how she does it. And it's not like she wears a t-shirt. She still has nice blouses, old lady blouses that are, have buttons and everything. She was a stylish lady.
No hope, I don't.
Yeah. Her son, who's a ophthalmologist, lives probably 5 miles from her in the same state. But he just comes over during, if there's a hurricane, things like that. But they live in the city, so it's not really, it's not like she's in the mountain. So these are the plight of some people, right? So they are, I don't want to use the word stubborn. Okay? They're independent. Okay? They value their independence. You gotta respect that. So this is the alternative. Okay? If you do not, because she was actually diagnosed early. She was in her 40s when she was diagnosed with rheumatoid arthritis. She refused treatment. She didn't want any of these. So same thing also, I had a co-instructor who taught psych, and she, it was a community college, community college have um professor degrees, right? So she was already professor emeritus, and she had these, and she refuses the treatment because I mentioned, aren't you gonna take Humira? No. Just like my aunt, she's like, yeah. Plus she, she's in Florida, but she was a New Yorker. You can tell accent's very heavy. Yeah. Right, so that's putting human faces to rheumatoid arthritis. Right? Any questions? That's it for today.